This is Day, and I got to do the differential diagnoses. So the first one we came across is obviously a thyroid issue, and when you're thinking thyroid, it could be either hyperactive or hypoactive. And because our patient has a goiter, and before we do labs, you're not really sure which one it is. So the first one we chose is Graves' disease. It is an autoimmune disorder. Two of the biggest symptoms that you see with an extreme case can be the exophthalmos, which is the bulging of the eyes, and then you have the pretibial myxedema, which is the connective tissue conglomeration that happens on the bottom of their legs between the ankles and the knees, and just causes these clumps of connective tissue with discoloration. One of the reasons why we chose this is, like I said, it is a thyroid disease, and because of the macrophages and everything in her labs, we thought maybe it was an autoimmune disorder, but it turns out that it's not this one. The labs do not correlate with a hyperthyroid disease. So next we looked at thyroid cancer. It is the most common endocrine malignancy. So obviously one that you'd want to think about first, especially since our patient, we'll get to that, but our patient came back with cancerous looking like endothelial cells. The symptoms are tumors, metastatic tumors, or nodules. Now, our patient didn't have any palpable nodules, so we're kind of leaning away from this one. Also, kind of rare for it to happen, especially when it's not due to some kind of metastatic disease. So, the lack of history to radiation, the needle biopsy would have come back negative, even though she did have those cancerous cells, which would point us away from thyroid cancer. Next is hypothyroidism. If it's not hyper, maybe it's hypo. So it is the most common thyroid function, which again would make us look here first. Symptoms are cold intolerance and goiter, among with weight loss, fatigue, malaise, and many others that are listed throughout the page. And you have a primary and secondary source. So you can read up a little bit more about this on our page as well, but here's just a little graph from our book that kind of walks you through the primary and secondary causes. The rationale for this one, like I said before, are her symptoms. The lab values came back and it does show decreased thyroid hormones, and the only thing that we're left with really thinking is what kind of hypothyroidism, because she still has those macrophages, which would show some kind of autoimmune disease. So we came to Hashimoto. And this is also an autoimmune disorder, but on the hypothyroidism side. The symptoms are same as the ones on the slide before. You have the presence of the goiter, her fatigue, her intolerance to cold. So all of those are lining up just as well. But then you also have the explanation for our labs. So her thyroid levels are low, but she also has that through-the-roof thyroglobulin antibody, which would show us that this is Hashimoto disease.